I'm only kidding.
Here's a more serious topic. The month of March is the National Colorectal Cancer Awareness Month. As a son, he'll tell you how his dad died from colon cancer. As a leading colorectal surgeon, he'll tell you why you don't have to. On the line with us is Dr. Brett Ruffo. Good morning, doctor.
Hi, good morning.
Good morning, Doc.
Hi, how you doing?
Not bad. How about you?
Not bad at all. Thanks for having me on.
Doctor, it must have been very difficult and weirdly ironic for what to have happened to your family.
Certainly unexpected, to say the least, but definitely something I'm very happy to be involved with now.
Now, did you go into this particular line of medicine because of your father, or were you already a colorectal surgeon?
No, I was actually my first year of my residency, so this certainly pushed me to do what I do, that's for sure.
What are some of the causes and some of the symptoms of colon cancer?
The scary part about colon cancer is a lot of times it's a very asymptomatic disease. Some of the symptoms that we discuss are abnormal bleeding, change in bowel movements, abdominal pain. Some people have anemia, some unexplained weight loss, change of appetite. But most of the time, that's usually a disease that's already advanced.
Now, Uncle Buck is here with us, and he has personal experience.
Yeah, I have. You better believe it. I had diverticulitis. I know you know what that is, and I'm still going to get. I'm going to be getting a third CAT scan to make sure I have the disease. Part of it needs to be taken out. But
you're in a different. Thankfully, the good thing about diverticulitis is that's a very benign disease. It's annoying and it's very painful and can have some serious problems. But at least it's not. It's not cancer, which is certainly a very, very different disease.
My father went through that colon cancer. He had it, and he died from it as well. But I know what you're saying.
It's terrible.
It's a terrible disease, and what people should be doing. Would you recommend that they should get a colonoscopy once a year to check, make sure there's anything going on in there?
Well, the beauty of this month is that we're able to talk about the things that can help decrease the incidence. Because although colon cancer is one of the leading killers, it's very treatable and preventable. So I think colonoscopy is certainly probably the best screening option we have. It's not perfect, but it's pretty good. Every year, no. It really depends on your family history and some other risk factors, but certainly by the age of 50, you should definitely have your first one, and then the follow-ups can be dictated with you and your healthcare provider.
Oh, okay. I appreciate that. And, like I said, I've been dealing with that for quite a while. That's the reason why. This is the fourth bout that I got with that. Had all that pain, man. I don't wish that on my worst enemy, man.
I'm not laughing. I'm smiling because
it's okay.
At least it's not. Like I said, it's not cancer though. But it's certainly a problem. Diverticulitis is definitely a significant problem in the colorectal world. That's for sure. But it's definitely not colorectal cancer. But it certainly wreaks havoc on many people. That's for sure.
We're talking to Dr. Brett Ruffo. He's a board-certified colorectal surgeon at Peconic Bay Medical Center in Riverhead. What are some of the treatment options available for colorectal cancer?
Well, there's depending on where the cancer is located, whether it's the colon or the rectum, the treatment options vary. Certainly, it's a combination of some medical treatment, surgical treatment, and again, the most important thing is can we prevent it or get it early. So the earlier we're able to pick things up, whether it be a polyp or an early cancer, certainly the better chance we have of restoring patients to their normal health. And so we're really pushing for the screening. But as for treatment, it's mostly it's a wholly multidisciplinary approach with the medical teams, the surgical teams, gastroenterology, and so forth. And usually there's many people involved in the treatment plan.
What else they should be doing to prevent that? Besides getting tests done. Now I know there's a sign. I'm sure there's pain with it.
Sure.
And how often should they do that? You really get a test about the cancer.
Oh well. That's two good questions. I think, the first thing is what can people do? Eat a better diet. We certainly have a very high-fat diet in this country. A high-fiber diet is very important, low-fat. Obviously, quitting smoking is certainly a significant risk factor for anything. And exercise. We know that exercising 20 to 30 minutes a day is beneficial against developing colorectal cancer.
Well, we do a lot of exercise. In fact,
that is for sure. Yeah. And also another question is for somebody that actually, obviously, by the time people detect this, it's usually too late. What signs do people get when they start detecting that they have this problem? It
really depends on the location of the cancer. The most thing that most people talk about is bleeding, change of bowel movements. Your stool gets thinner, or you start having this abdominal pain and bloating, just feeling kind of lousy. The good thing is that you mentioned that it may be too late. Obviously, the earlier we get any patient with cancer, the better. However, it's still a very treatable disease regardless of the stage that we get to treat the patient. So patients need to be aware of there's many treatment options that are out there available that we can really help a lot of patients regardless of stage. However, the earlier the better.
It is pretty interesting to get in there. Does this affect men and women equally?
It does.
Really?
Yep, it's the number 2 cancer killer in the country.
And any correlation, though, to people that are overweight or
yes.
people that are... There is, huh?
Absolutely. Obesity is a very well-known risk factor for colorectal cancer, as is exercise is just the opposite.
Yeah, that's very true because I took a lot of weight. I took up 130 pounds off.
Yeah,
good for you.
Frank took a lot of weight off.
Yeah, me too. So it's kind of important
Rob,
to make sure that you stay in shape and do that. All right. So if people would like some more information, where can they go?
Well, we practice out here in Peconic Bay Medical Center. We're very active against screening, and for most patients, they're primary care physicians, they're gastroenterologists, colorectal surgeons. That's what and we all try to do our best to improve our screening for all the patients that are out there.
Yeah, I think it's almost getting to the point where we all know somebody that has gone through, and I'm actually I know some people that have passed away from not getting the treatment. So. It is very worthwhile to check into it and
it's critical.
Healthy. Yeah, very, very much so. Well, thank you very much for coming on the air and talking about March being National Colorectal Cancer Awareness Month. Thanks for coming on the air with us.
Thank you very much, guys.
All right, take care.
Thank you, Doc.
All right,
there
you go.